Thank you. It's a pleasure to be here today. As Dr. Wilson noted, cases have continued to rise over the last few weeks in the state of Alabama and also here in Jefferson County. With this number of patients rising, we've also seen an increase in the number of patients requiring hospitalization for COVID-19. At UAB Hospital, that's required us to activate portions of our surge plan. We talked at the beginning of this pandemic about how UAB had designated an intensive care unit and an acute care patient unit to care specifically for COVID-19 positive patients. The number of beds that we allocate to these units is really based on the projections of how many beds we think we'll need based on the number of cases in the community. As the number of patients requiring hospitalization has increased over the past 2 months, UAB has once again been forced to designate additional beds for COVID-19 patients. Now, this primarily involves us having not only a bed available, but we have to have the appropriate staff available and the medical equipment available to take care of these patients. They have unique needs that we have to serve to make sure not only that we can take care of them, but that we can prevent the spread of disease within the hospital. Now, the downside of having to designate these additional COVID-19 beds is that means that resources are just not available to take care of patients with non-COVID medical needs. When we have to rededicate those resources to COVID, that means those same resources are not available for other things. If we continue down the path we're on right now with this ever-increasing number of cases, we'll have no choice but to curtail services in the future for important elective care. What that means for you is you might see a delay in your care. We don't want to do this, but we're preparing to do it if we need to. And it's something that all the hospitals in town have been talking about, and it's something that we don't want to do. But if we continue down the path we're on right now, where we have unchecked disease transmission, that's what we'll be forced to do in the future. This summer, we've created additional space for COVID-19 patients in our hospital. We did a lot of this in our emergency departments. So we were able to create spaces in the ED for shifting our waiting room care around, and this has been helpful in managing the increased number of patients with COVID-19 related illness who are presenting for care. So by shifting some of these spaces around, we've been able to expand our capacity, and that's really helped us a lot in making sure that we can care for this increased surge of patients. This is something that we continue to do today to make sure that we have the care provided that you need. The UAB emergency departments at the main campus, at Highlands, and at Gardendale are open to care for you for COVID-19 and also for non-COVID related complaints. Now, we don't want to overwhelm our emergency departments with things that are not emergencies that might be better suited to be cared for in another environment, like at the urgent care, at your primary care physician, or on telehealth visit. We still strongly encourage you to come to the emergency department if you have a true medical condition that is an emergency. So things like heart attacks, strokes, trauma, asthma attacks, those are things that are emergencies that you still need to come to the emergency department for. But if you have things that are not truly a medical emergency, you might want to consider having those things cared for in a more appropriate environment so that we don't overwhelm our emergency departments. Our hospital leaders in Jefferson County and throughout the state have been in constant communication with one another. And what we're hearing from all of our colleagues is that all the hospitals in town are really dealing with the same issues of surge planning. Last we checked this morning, the number of COVID-19 positive cases who are hospitalized in Jefferson County is approaching 300. And we have just a little over 100 of those patients at UAB Hospital right now. You know, other hospitals in town besides us are having to manage this influx of patients. That's why it is so imperative for the community to take all the appropriate actions that we're urging to avoid continued spread of this virus. Do the things such as social distancing, wearing your mask, washing your hands. I know we've said it over and over again, but these things are so critical if we're going to be able to continue to provide the care that we need to provide. In the past, we've had some issues with PPE supplies. I wanted to address that today. That has not really been an issue for us lately. Our PPE supplies have been stable. This is in large part due to creative sourcing from our supply chain professionals, folks who dedicate themselves to making sure we have the things that we need to take care of patients. But this is something that we're continuing to monitor because we do anticipate some sporadic shortages of critical items that we need to care for patients. So Right now, we're okay, but that could change in the future. I'm going to close out by making a couple of comments about our employees. As community spread has become more prevalent, this affects our employees as well. Our employees, they have lives outside of work too. They have families to take care of. They have children in school. They have parents to tend to. We've taken some pretty aggressive measures here at UAB to monitor our employees for illness. We do a daily health check through a little app that we've created that checks on our employees to see if they're sick. We have the GuideSafe exposure notification app that we use. So we do a lot of things to monitor our employees. And then we isolate them when needed. And we have an aggressive testing strategy to test and quickly control spread of the disease. Up until recently, we've been very successful in keeping the employee cases down to a minimum. We've had really good luck with that. But here lately, as community spread has increased, this has impacted our employees as well. And we're beginning to see some staffing shortages related to the impact of COVID-19 cases on our employees. This is why it is so important that we all do our part to be responsible, stop the spread of the virus, just like we've done several times in previous months. I know I've come to you and I've asked you to be careful about mask wearing, to be diligent, and I'm asking you again to please help us with this. Don't give up on us. We're tired. But we're not going to quit on you. We're going to be here for you. We're going to take care of you. So please do your part to help us stop the virus so that we can be available to provide all the care that you need, not just care for COVID.